Welcome back to the Best PT Podcast. This is episode 13, talking a little bit about bed mobility and transfers. So some general bed mobility guidelines. Remember that dependent patients must be repositioned at least every 2 hours. Skin inspection should occur with each repositioning, and you should always lift a patient or use a draw sheet to avoid shearing forces. Levels of physical assistance. Independent, no assistance is needed. Supervision, the task needs to be observed. Contact guard, the therapist provides contact but no assistance. Minimal assistance, 25% assistance to complete the task. Moderate assistance, 50% assistance to complete the task. Maximal assistance, 75% assistance to complete the task, and dependent, 100% assistance to complete the task. A few different transfer types. For dependent transfers, the 3-person carry. Therapist 1 supports the head and upper trunk. Therapist 2 supports the mid-trunk, and Therapist 3 supports the lower extremities. The 2-person lift. Therapist 1 places their arms underneath the axilla from behind and crossover grabs the patient's forearms, while Therapist 2 supports the lower extremities. In the dependent squat pivot, the guideline here is do not allow a patient to pull on your neck or put their arms around your neck. And then finally, for fully dependent transfers, a hydraulic or mechanical lift, also known as a Hoyer lift. And then 3 different types of assisted transfers: sliding board, stand pivot, and stand step transfer. That's it for episode 13, talking about bed mobility and transfers. Episode 14, we'll talk about wheelchair evaluation and fitting. As always, the outline will be in the show notes. Thanks for joining.